Good evening. I am Brother Dr. Jeffrey Sterling, Surgeon General of Alpha Phi Alpha Fraternity Incorporated. And typically, I will say on behalf of our General President, Brother Willis Lanza III, but instead, this evening, on our conversation on Black health and the Alpha Phi Alpha Surgeon General Initiative, I'm actually going to start this evening with a quote from Brother General President Lanza, who famously said, "When I campaigned for General President, I committed to bring forth a new paradigm focusing on the improvement of the health of our brotherhood, as well as an extension of that awareness to impact our fraternity programming and even our community partners." With that being said, I'd like to welcome this evening's panel, which does include the 36th General President of Alpha Phi Alpha Fraternity Incorporated, and we also have assembled 5 of our 6 Deputy Surgeon Generals, who I will acknowledge. Brother Dr. Langston Smith is our Deputy Surgeon General for Dental Health. Brother Dr. Victor Narcisse is our Deputy Surgeon General for Family Health. Brother Dr. Christopher Womack is our Deputy Surgeon General for Healthcare Disparities. Brother Dr. Ron Kennedy Bailey is our Deputy Surgeon General for Mental Health. Brother Dr. Robert Carter is our Deputy Surgeon General for Tropical Health and International Medicine. And we have Brother Dr. Torrance Brown, who is our Deputy Surgeon General for Public Health. He's not with us this evening. With that being said, we have a robust conversation to have with you. And without further ado, I'd like to offer up our General President for some welcoming remarks and opening remarks. Good evening, sir.
Good evening, Brother Sterling. Good evening to all Deputy Surgeon Generals who are assembled, as well as to our brotherhood. A great and warm greeting from a hotel room in Washington, D.C., as I try to finagle all of the things that I signed up to do when serving our good brotherhood. It is a pleasure to be with you as the Advent season approaches and family celebrations. I know that there are also times that it can be a bit dark for us because we've lost loved ones and there can be mixed reviews, but I hope that the message that I sent out just prior to the runoff election for our brother Senator Raphael Warnock, who now has been reelected to the Senate, and we can raise our arms in celebration for that, and salute all Georgians for their astute selection of that particular lever in the voting booth. But we also are celebrating in the MAC and specifically in the state of Maryland, the election of Brother Wes Moore as the governor-elect and the first Black governor of the state of Maryland, where our headquarters is seated. So when I walk into Maryland in the year 2023, I may be stepping a little higher than normal, as I know that the man in charge of our state where we are seated is an alpha man. But brothers, I come bringing commendations to the entire Surgeon General initiative for your stalwart efforts and initiatives as the fraternal administration now moves very close to the midway point at December 31st of 2022. We have two full years left, and I'm looking forward to continuing to partner with you. So, brother Dr. Sterling, my Northwestern Wildcat 1982 initiate of Alpha Mu chapter, who just celebrated its centennial among those chapters. Congratulations and to you and to all of the brothers for your work. Dr. Narcisse is down there keeping geriatricians and in the geriatrics community very happy. I know that he brings a wealth of knowledge for our family medicine as well. Brother Bailey and I were able to enjoy a New Orleans classic sausage and vaucressons, 1899 product in New Orleans, Louisiana. I learned to say vaucresson when I was in New Orleans. It was vaucresson before I moved into that area that night, but I came away very knowledgeable. I know Drs. Womack and Carter have us well covered in those areas that they are supporting. And I'll see Dr. Smith sometime in a couple of weeks as I come in to support Ida Upsilon Lambda's Dr. Martin Luther King Jr. Memorial Day. And I know all of my dental products are looking strong. You'd be glad to know you don't have to get the hook out on me to test to see if I've good enamel characteristics, brother Smith, I'll be all right. So, brother, so good to see you all, and again, thank you for your great work.
Well, I hate to rebut you, brother General President, but the Surgeon General Initiative, as you've designed it, is meant to take care of the brothers. And of course, you are first of all. So we will be checking on you every chance we get.
Indeed, gladly accepted. Thank you.
Let's go ahead and get started with, we have several questions, and the various deputies will be asking questions. But let's just start, if you will, by taking us back. At this point, phases 1 and 2 of the Surgeon General Initiative have been robustly implemented. We've done well over 50 of these webinars, mostly every other Thursday or twice a month. After starting for most of the first year every week, what were we thinking back then, right? And we've done almost 50 video blogs that are over on Sphinx TV for viewing anyone anytime if they want to get a quick question to their health concerns answered. Can you just take us back, if you will, and discuss the progress of the Surgeon General Initiative from its inception to where you view it being currently?
Absolutely. I think that first and foremost, the Surgeon General's initiative, or the Surgeon General Initiative, was a novel concept that I believed I had hatched in my own mind, but to surprisingly and but pleasantly surprisingly come to the realization that brother Jeffrey Sterling and I and Dr. Sterling and I have had conversations outside of the administration when I was actually seeking the office of General President, and we were keenly and almost uncannily aligned on a lot of things. So us coming together to talk about what this could evolve into really was very. I don't use the term organic because I'm like probably most of you still think carbon-based molecules when I say organic, but it naturally evolved in our discussion, and I see what was a burgeoning idea and a concept to impact favorably the health perspective, the health management, and the health forecast for alpha phi alpha to go from something literally in an embryonic stage to where it's evolved now, where brothers have gotten comfortable in hearing in the various components where we're touching significant areas, mental health. We're talking about how we age and how we progress in our family medicine. We're talking about international tropical health, public health. We're trying to make sure that we manage healthcare disparities as an entity because there's such a myriad of those that impact us as an African American community, but in the broader sense of Alpha Phi Alpha's diversity, the Latino and Hispanic community brothers that we have, the Asian American brothers we have, and the Caucasian brothers we have, to make sure that we are addressing a broad cast. And then we bring up the middle with you got to have a nice smile. I've always said that. And something that Dr. Smith definitely can say, and I know a few brothers who I know are going through health challenges. I know based on their own dental presentation, it's a sign of health when your teeth look healthy, and when they don't, that means that there's some things that maybe need to be intervened with here. But I'll still say that we have a wealth of luxuries with this cavalcade of Black physicians and scientists who can come together to bring things together. And we had each of you, and we even had a Jeffrey Sterling MD with the right ER training where he can deal with a nail in the eye all the way to something as innocuous as I got a cut on my finger, with some public health training from Harvard to help us try to make sure we can shape some outcomes and work with all of you to be a good communicator to ensure that we bring a full complexity to the health, wellness of Alpha Phi Alpha internally, and work in concert with Dr. Smith and his team and the external facing as well. And that's Dr. Michael Smith, our good brother, who's also in Iota Upsilon Lambda as well. I'll leave it there, Brother Sterling, unless I've left something on the table.
No, that's a fantastic overview. Thank you for that. Let's go over to Deputy Surgeon General Brother Smith for the next question.
Okay, thank you, Brother Sterling. Good evening, Brother Lonzer. Good to see you.
You
And
too,
I
sir.
would capture that, what you just said. As you know, the mouth is the opening to good health. So thank you very much.
Indeed.
Okay. As we look at the what we've accomplished, uh, as Brother Sterling iterated, a number of webinars, a number of video blogs, and we've covered a multitude of topics that have been of import and of interest and have been well received by our membership. The question that I have for you then is, what is your vision of the future of the Surgeon General's initiative, and what path should we take to embed and perpetuate the program in the Brotherhood?
Great question, Brother Smith. I'll start by saying, first and foremost, we should recognize our work, and I include myself with you all as my professional areas pull me into the pediatric arena with inborn errors of metabolism and immunomodulatory therapy development and things of that nature. So these are things that are impacting us. We should look at this as a ministry to our brothers, a ministry in the sense that there has to be a continuum of education, and that there are always folks who are going to be uh, impacted by social and socioeconomic challenges. With that being said, putting that as a preface before where we move, our idea to elevate the fraternity's knowledge around health issues and health care and health management, but bringing to bear those areas that are of particular interest to Black men, Latino men, and other men of other cultures, to ensure that we're going to have as long and productive of a life as we can. So that may mean that we take a phase two approach to some of the topics that we've approached already when we talk about diabetology, when we talk about cardiovascular disease, gastroenterological disease, as well as mental health. I know Brother Bailey is smiling because I didn't leave him out. It's indeed very important that we take all of those components into consideration, as well as other new areas that we need to advance. Part of it I see evolving is us bringing to bear in the next 2 years of the administration an opportunity for us to even minister to and talk with our fellow scientists and physicians and pharmacists and pharmacologists, et cetera, about new treatments and therapies that are coming, the mechanism of action, making sure that we can come to the table and have some productive discussions. For example, even very recently, I was on blackdoctors.org and put on my pharmacology hat and talked about the fact that uh, infertility and sperm count drop that's been allegedly associated with COVID-19 vaccinations have actually been debunked by studies that have corroborated an increase in sperm motility and a maintenance of a high number of sperm for those brothers who are young enough to still be productive. I've been removed from that arena. If and there are other brothers who may be as well, but it's important that we be good messengers around the accuracy. I mean, we definitely have to take into account Henrietta Lacks's experience with Hopkins, as well as the Tuskegee experiment, et cetera. But it takes for us as Black scientists and physicians and dentists and pharmacists and other areas of health that we venture in to be the spokesperson to help debunk those misnomers that are associated with it. Lastly, uh, and how do we embed it into the culture of Alpha Phi Alpha? Brother Smith, we have to make the brothers want this as a part of their plate. Very much like Obamacare. Once the general public was exposed to this new entity, very much like the New Deal was or the Square Deal was, the folks were like, well, you're not going to take my check away from me. This is what I am expecting, and I want us to make sure that we keep the brotherhood in a mindset that they are expecting to receive updates on their health, that they're more health forward in their thinking, more health leaning in their thinking. I look at the brothers as I see them in fraternal love, and see brothers who are challenged with family health histories, morbid obesity, you name it, or even dealing within the or the manageable spectrum of obesity. I mean, I'm happy to say that I'm only 9 pounds away from an ideal weight that I have now. And much because my own health habits and my own eating habits have changed as I've aged. So the more we can equip our brothers, the more I think we can try to stay here as long as we can and continue to transcend all. I'll leave it there, Brother Smith, and then find it if you have a follow-up.
All right.
But,
Thank you very much, Brother President.
Brother Lonzo, I'm not going to move you off this topic yet because we've talked at length about how to further what you were talking about, and that involves the inclusion of younger healthcare aspirants within the organization. So I would be remiss if I didn't let you follow up on that as well.
I appreciate the opportunity, Brother Sterling. I think it's imperative, and all of us who are in some way involved with this initiative have gone through post-baccalaureate training, formal or informal research, and an alignment of how scientific and medical, and I'm using that as the broadest umbrella, mind you, not just clinical medicine, but clinical dentistry, clinical pharmacology, clinical biochemistry, as well as research in those respective areas as well, all lead to new ideas, new therapies, new treatments, new paradigms. We have a bevy of brothers who are coming through, who are future psychologists, psychiatrists, future cardiovascular or interventional cardiologists, you name it, gastroenterologists, ER physicians, geriatricians, tropical medicine proficient people, as well as those who are looking at specifically health related matters. When we talk about healthcare disparities, I have to remind myself that we have not gotten out of the metabolic syndrome as a culture. This is something that we have an opportunity to do it. What better way than for us as alpha men who have entered into these areas professionally to help shape the paths, either formally or informally, as mentors for our young brothers who are in aspiring to graduate a professional school, those who have a tie even to health law or to the law, and being a good resource for them as they build out a compendium of experiences to help shape their paths and careers professionally. There are several brothers I know at Columbia University School of Medicine now who are ADA initiates who wanted to be assistant deputy surgeon generals. We can definitely fashion this, but I want to make sure that we bring them at parity to the surgeon general in the sense of the scope of what they do, that they build on and take on some responsibility while the surgeon general or the deputy surgeon general may be the point. The assistant has the opportunity to make sure that the voice, and we do not lose aspects of oncoming things and things that they're seeing evolving in their own training that I think could be beneficial. I mean, that's the broadest swath of that, Brother Sterling, but I'm more than happy to take any follow-up questions if there are.
Yeah, I do have a follow-up, Brother John President.
Sure.
You mentioned that we have to make the brothers want this, and you talked about the Affordable Care Act and how that was done. Thus far, we have done the webinars and the blogs, but are there any other pathways that we can get them to want this? For instance, you know, information in the Sphinx magazine, information in the newsletters. What are the pathways that you recommend that you have in your vision that we may use?
Well, I'm glad you mentioned the Sphinx. I think the Sphinx magazine, being the traditional voice and organ of the fraternity, is one in which we need to definitely leverage. Sphinx TV and Sphinx Radio. And you've been implementing that right now. I think us reaching out, even sometimes bringing external speakers who may be from the broader medical and scientific community, It could even be a lady, I would say ideally a Divine Nine member can come in and sometimes bring perspectives for us. And I'll give you a tee up that's going to happen. I just had a conversation with our wonderful brother, Dr. Charles Loeb. He was a retired obstetrician and gynecological surgeon, about developing a program for our brothers that we can work and work through the March of Dimes is something that we offer to them, helping us with special needs children of our own. How we need to, even from when we have a neonate who likely has come into the world and has to be in an incubator, how can we better bond with our children, understanding the reality and talking to them about, for example, surfactant implementation so that they can develop pulmonary capabilities more easily. Much like I've talked even, for example, with Brother Smith some years ago, how some immunomodulatory therapies can induce dental caries or cavities in our people when they're taking different medications. And so we have folks with rheumatoid arthritis, folks with IBD, which is ulcerative colitis, and or Crohn's colitis, and there could be a continuum between those, as well as folks with psoriatic arthritis, just as an example, or psoriasis, who are relying on anti-TNF therapy. These immunomodulatory therapies have been associated with cavities, and just trying to prepare our community and maybe even be a think tank forum within this sphere, but definitely globally. When we think about our abilities as a fraternity at broad, we want to make sure that brothers come to us, and we have to have the disclaimer: we're not giving you medical therapy and telling you what to do. There's always the need, and there's always someone on the spectrum somewhere in our fraternity who might just say, well, I'm going to sue the fraternity. We don't want that, of course. But we do want to provide them good insights so they can have a strong communication with their healthcare provider. So I think that, Brother Smith, the utilization of every social media tool, blog posts, whatever, and I'm working with the executive director now to ensure that we can have staff level support for general committees and chairs. Another piece is for us to move us from this ad hoc form to maybe a standing committee for the fraternity, so that it can be a part of the constitutional binding general committees that serves the brotherhood. As a standing committee, that means that will not go away. So I think in the utilization of all social media, and I believe that everyone on here, including the deputies, but those who may be participating, I was just surprised having Henry Arthur Callis as our jewel founder, B. Andrew Rose as general president of the fraternity, who was a physician in Dayton, Ohio, and now with yours truly, at least as a scientist and an expert in biochemical genetics and immunomodulatory therapies and all of this. Why is it taken now in our second 100 years for us to get health on our radar? I think VPHP and education are critical and should always be the hallmark of Alpha Phi Alpha. But with as many physicians and scientists that we've developed,
That's right.
There is no way in Hades, I'll be nice, don't know who's listening, why we wouldn't have a health initiative here. And brothers will say, well, what about prostate cancer? I said, brother, we've already covering it in the Surgeon General initiative. So it's very critical that we let our brothers know that we are concerned about their health as well. And, that we want physicians and scientists who are there. And these are broad terms, but if you're a family practitioner, all the way to the researcher in the lab that's developing new and oncoming therapies, we want this to be a forum that you can come together and we can come together and educate each other as well. You need to understand the new modalities that are coming out. I need to give a talk on CRISPR to the brothers. So in case there are brothers who don't understand what CRISPR is and what it involves, and how even in rare disease, it's still in its embryonic development, but already making inroads for potentially a person who has sickle cell disease, which impacts many of us in our families. So there's just a myriad of things that we can do. I'm excited. Again, I might even look, all of this may be black. It may be Grecian formula, but I'm going to change it so that I can say that I'm on the leading edge with you as we're introducing and making health not be kabuki theater for people, but we'll be proactive in going and getting our prostate checked and helping brothers to understand, yes, there's a blood antigen test that's allowed with that, but that digital rectal exam has its place. It's important. And I've jokingly told the brothers, I have a female physician to avert the big burly finger concerns that some folks have. If you can be, but it's important that you take it on and understand that your prostate health, it needs to be palpated, it needs to feel soft, as well as getting that blood antigen test, the PSA test as well, to make sure that you are covering all bases. Now all of you are smiling and know there's some logic to what I'm saying. So, you may want to change on your own so you won't be so reluctant to get that annual physical. But my brothers, I'll leave it there, brother Sterling, brother Smith. If there are further questions, I'm glad to take it.
You have done a program within the program. Thank you for that. We're going to be coming back to some of that. And to the brothers that are listening, we just want you to know there are over 100 brothers who participate now in the Surgeon General Initiative, including public health professionals, administrators, anyone on the periphery of healthcare. We have more talent than we are able to deploy. And as General President just pointed out, there are so many different directions that we have the ability to address, and we are evolving that bandwidth. So let's continue on. We have some more good topics for discussion here. The next question is going to come from Brother Deputy Surgeon General Carter.
Dr. Carter.
Hello, Brother Dr. General President. So this is a great follow-on question to what we just talked about. So there's a number of initiatives as high as the White House level, specifically looking at how do we prevent the next pandemic. I'm actually right now in San Francisco at a Defense Threat Reduction Conference where we're talking about new diagnostics. How can we basically prevent the next pandemic? But with that said, we know that the COVID-19 pandemic impacted the African-American community disproportionately, and many of those consequences may have long-term impacts within the community. What can and what should Alpha Phi Alpha do to reduce the impact of healthcare disparities? And a follow-on question to that, and I think you touched on that just a bit, is how do we support the trust building of the medical system within our community?
Well, I think first and foremost, thank you for the question, Brother Carter. I think that one of the very critical things that we are doing right now is aligning with key community partners who are seeking to educate the general community about healthcare and what we do. I also want to suggest that, for example, we are partnering with Good Health Wins, which is a offshoot of the National College of Negro Women. And if anyone's flown into BWI recently, you may have seen my face on a placard inside, or several placards inside, promoting folks to get their influenza shot and COVID-19. I think the more that we put faces like ours within the community and work within community programming through chapter level, through the district, through the regional convention, and give an opportunity to provide education to our communities, it will make a difference in helping to leverage a voice that they can begin to learn to trust. I think much like the discussion I had with blackdoctors.org, we need to have our own mini compendium. And I think conventions are nice to work through, but I think leveraging our social media component, Sphinx TV and Sphinx Radio, webinars like this that you've been doing are the right way. Now we have to also make sure we use the appropriate promotion of those, and perhaps even sometimes open them up, certain ones, not maybe everyone, but maybe every quarter or so we open one up to the community. I appreciated when Brother Sterling went and talked with the Cleveland Clinic in Cleveland about some of the things and initiatives that are there, because it's important that we help Black folks to understand, but Latino folks, we need to help Asian American folks, we need to help folks who are from the Native American community who may be affiliated with us, either formally as brothers or those who may be within our territory, that we are a voice that speaks for them and can help provide education to them. Last piece, when we talk about the prevention of the pandemic, I think that there's some challenges in probably how that's going to happen because we still live very close to livestock in other parts of the world. However, Brother Carter, I'm sure that within you all's logistical discussions, I think helping folks to understand, much like I think the broader Asian community has, that the implementation of a face mask as a barrier can be very helpful. Unfortunate for us, we had probably the most fascist individual I've seen since Benito Mussolini in the White House at the time that this pandemic took place. And since that is the case and is the situation, we now have a re-education opportunity. So I want to make sure that we say that, and I got to remember where you are, Brother Carter. I'll try to help you with that. That we say to the broader community that a face mask can make a difference, that good hygiene and the utilization of I'll call them antiseptic products in their purest form, then put your lotion on later. I've noticed that we've seen an implementation, vitamin E and other things in these antiseptics. When they lose their volatility and their ability to combat any bacterial or viral presentation on the skin, that becomes complicated. And I know Brother Carter's smiling. I think I hit on a positive smile. So sometimes just using 70% or 90% alcohol as that dowsing to do that lens, then put the lotion on once you've cleansed yourself and rehydrate your skin. That may be the better method. Did I touch on it well enough, Brother Carter? Did we need to talk a little bit more?
Let me jump in there because I want to pick up where you left off and just kind of point out that to his specific question, Alpha has, through this Surgeon General initiative, done exactly that to some extent. You mentioned a few examples, but I will also point out over the past year how the fraternity was able to partner in the vaccination campaigns. And the concept of the trusted messenger is really what we're talking about. And within the talent that exists within the fraternity and the positioning of the fraternity to be a thought leader and a thought implementer of considerations for our community, that's the direction in which we want to continue to go. And I think that's really the point to be made. And to the fraternity's credit, under your leadership, we actually have started to take steps in that direction.
Well, I appreciate that. I sometimes it's better to think about the things that you've done and realize you left something off than having not done it. So I agree. One of the very key goals across not only this initiative, but all, is for us to present ourselves as strong community partners. And I think we're doing that across many areas, including within the Surgeon General initiative.
Thank you. I must say I am really pleased at how well received all of our webinars have been received, and especially the mental health. Dr. Bailey, you have really struck a chord. Your team's witticism and plain speak and factual expertise really has touched on something that the brothers are yearning for. And with that in mind, I'm going to toss it over to you because I know your question is in regard to that. So without any further ado, floor is yours. You are on mute, Brother Bailey.
Sorry about that. I think I was on mute. Well, thank you very much. I think, Brother Surgeon General Sterling, you're 100% right. I've been very pleased as well with the level and amount, and I think in quality of participation of the brothers, I think, who've been on our committee. We've had up to 14 or 15 Alpha brothers and Alpha men join our task force and participate over the course of the last year to year and a half, which I think does speak, I think, volumes to the fact that we are well represented as an organization with persons, I think, involved in mental health and really working, I think, in the trenches in VA hospitals and university settings, in private practice and government settings as well, to address these issues for Black men and others throughout our country, and especially for members, I think, of our fraternity. I as well sort of want to thank our 36th General President, Brother Alonzo, for conceptualizing this idea. And really, my question today is just really to take a step back and really look, I think, comprehensively at our work product. Acknowledge that I do think that we're moving in the right direction by embracing issues regarding asking the question about brain health and brain disorder and brain disease, which unfortunately, due to stigma, has been adverse in our African community for not just decades but centuries, to our peril and to our detriment, because all too often persons have more medical illness. If you have brain illness, it should be a marker to really dig down deep and assess what may be a initial start of a medical problem that could eventually lead to more substantial morbidity and even an early mortality than is indicated. So that being said, I think my issue is to kind of put the pedal to the metal and really press the gas to ensure that we continue to move in this direction. To really ask you, do you think that there are additional opportunities for us to kind of grow, I think, our bandwidth? I'd love to see us have mental health on the agenda, not only nationally with the Surgeon General Initiative, but at our state and regional and national meetings to ensure that we take a leadership role as an organization of African American men, acknowledging that we're people too. We have brain illnesses just like cardiovascular and obstetrical and not obstetrical, but orthopathic and issues regarding diabetes and obesity and the like. And if we ask the question, we're a lot more likely to give brothers, I think, a safe harbor to acknowledge that they may be having some problems and give us a chance perhaps to provide some degree of benefit and intervention and help. So with that in mind, I thank you again for giving us opportunity. I hope we can continue to really dig deeper and bring, I think, value to the brotherhood. And just really ask, do you think there's some additional opportunities for us to move forward in this initiative?
No, but Brother Bailey, I'm glad you posed your question in that manner. I took a minute just to look at some of the comments that are being posted on at least the Facebook Live, for example. And I need brothers to do two things. First, like we used to always say, take a chill pill. Many of the things that you're mentioning have been thought about, but it's important though that perhaps through the Surgeon General or to brothers that you know who are affiliated, that you share your comments to make sure that we know we're still striking the right ground about what's needed. So while you may think we're saying we don't know where to go, no, we do know where to go. Some of this is a bit rhetorical in the sense of us posing it to help make sure that we can capture your perspectives too. So I welcome those and would encourage you, especially if you know of an area that you think is of some significance that you observe, let us know. Brother Bailey, I think one of our greatest opportunities is to help in two, you kind of mentioned it when we talk about the morbidity component. I think about folks who go untreated, for example, for certain disorders, and they induce neurologic, we'll call it in the broadest sense, neurologic decay, either through direct loss of brain cells and tissues or induced through, let's say, challenges to their cognitive learning ability and things of this nature that we never talk about. Some to the fact that we will dismiss it and because we don't understand the significance of what the diagnosis may be due to either poor communication or whatever, or a lack of engagement or belief from the family. But I think there's some place for Alpha Phi Alpha, as you mentioned earlier, to maybe have some more of a role at regional and district meetings respectively, to talk about areas that are key. But I think it really is about casting as broad a net as we can, trying to bring in probably a little bit of a different infrastructure as we move forward. Now that we've launched this behemoth, now we will try to manage it and make it so that it's not too unmanageable for someone to continue forward, and that many of the areas like yours you speak of and other areas led by other deputy surgeon generals drive themselves. And it's really just trying to put an overarching loop in or mark, and as well as communication platform and plans in place to make sure that we can reach those that are there. The last piece I'll say is we need to make sure that folks understand that, to your point, there is not a stigma with mental illness and challenge. I think I can't even say it, loudly enough. And I realize that I am not the expert in the call is Brother Bailey, you know, but at the same time, many of us have touched it through our respective work professionally. And I think that if there can be any way for us to continue to say that there's one placard that we will keep for sure, is to make sure that we recognize that mental wellness and mental health challenges are very real in our community. And we must think about ways for us to help our broader community through especially educating on the chapter level. Most brothers don't go to general convention. Most brothers don't go to the regional convention or the district conference, but brothers do touch their chapters. And I think if there's an opportunity for us to, I'll call it an SGI toolkit of just some core things that brothers could be able to look out for. We provide for the chapter level brothers who engage primarily through that mechanism. I think we will leave us with the right stride and the right orientation towards keeping health and healthcare initiatives at the forefront of this fraternity.
Fantastic. I actually want to have Brother Deputy Surgeon General Narcisse take the next two questions. And why don't you start with your second question, Brother Narcisse, because that actually follows up where we are.
Yes. From the Family Health Committee, we have been speaking about health disparities and trying to change the dialogue from health care to wellness. But this is such a behemoth, as you mentioned. We struggle with how to manage all the information flow. And you mentioned management. We believe that we can't manage what we can't measure. And so we'd love to get your thoughts about how to best measure the effective, what you would describe as the measurement of success for us. And I have a follow-on question about some of the technical pieces of that.
Sure. I think that there are some low-hanging targets that could help us to at least identify the penetration that our messaging and our discussions are having with brothers and their families. Much like an organization uses a scorecard, we can implement a scorecard that may track with the brother, and it can be captured in true HIPAA form in the next, I'll call it in a blinded way. So we can look at the aggregate of the data versus specific responses, but try to, of course, follow up where we can, and making sure that as a brother going for an annual health exam, but prior to beginning the Surgeon General, were you doing that? If so, are you still going? How is it are you passing this message on to your family? But also beginning to just try and track the general health component of brothers. It can even be done as a small pilot to help us at least understand the data that we see, and then maybe roll out a broader initiative that looks at maybe the wellness, to your point, Brother Narcisse, and I think it's spot on, of how brothers are maintaining their wellness, their ambulatory capability. Are you out exercising? Do you if you're not biking, are you golfing? Are you walking? So that we can understand where brothers are, how they're aging, how long are they able to, how's their mental capability? One of the brothers teasingly said, "Do you take Prevagen?" Because I have a pretty good memory for different people cross and they're in the year they cross, etc. This is this data aggregation and familiarity. But I think that there are some other tools that we can look at organizationally, Brother Narcisse, that can help us to say, is our message penetrating? And some can be implemented through small polls and through surveys to at least give us a baseline and understand where brothers are and if we feel that the Surgeon General is reaching them, not necessarily impacting them. Is the information reaching them? And then we can think about strategies to increase our reach. Does that make sense?
Yes, sir.
Good. And what's your follow-up question, my brother?
um, what I think you actually touched on much of it. Whether or not this is something that you'd be willing to survey, to bring to institutional review board, to aggregate, and to perhaps even discuss on a broader scale through the medical literature, through our gatherings about how we're doing and how effectively we are working towards our goals. The second part of that, of course, is that to do that, we have to have sustained effort. The organization has partnered with a number of healthcare organizations. Some of those organizations have additional resources. What infrastructure do you think that we're going to need to make this a sustainable effort? Is this something that you think that should be funded internally, or is this something that will require outside support?
I think it could be a bilateral approach, to be quite honest with you. I think that we should primarily depend on our internal funding and efforts, but there could be initiatives that could be externally supported as well. What that infrastructure will require, I think, is we're still building this ship as we're flying, to be quite honest with you, because I think that there has to be, first, like I had mentioned earlier, some constitutionality to ensure that this entity is ingrained in the very fiber of the fraternity. And with that being said, it will take a general president who is open enough in mind to understand that he may not be the expert in these areas, but there's still a need. And I think much like there are no lawyers, there may be someone who has a law degree as well on this line, maybe not, but it's just like the tie to health law, the tie to just like we see the tie to research and drug development tying to this community. And there's a misnomer, and this is not meant as a disrespect, but you cannot be the expert on all of these molecules and entities that come out. We have to depend on our brothers who are a part of other companies and things that touch this and touch it at the molecular medicine level and work in partnership with each other where clinical, where the bed and the bench side are coming together and making sure that we can clearly articulate to our brothers what these are. I mean, it's just like, the best example was with the COVID-19 pandemic and the utilization of any type of vaccine. I had more conversations with friends from college. I've talked to brothers and sisters through a working group. But it was what my most pointed argument was to someone. Now you'll trust Pfizer and take Viagra, but you won't take the vaccine that they developed. Doesn't make sense. There's a trust implementation in both scenarios. And while my friend gave me the best high five he could through the line, that's a great point. It still took him about a month to get up to speed to be able to take that vaccine. But it takes us having some very direct questions with our brothers, our understanding of what the best cardiovascular management is for our brothers and sisters. I know, Brother Narcisse, you know this hand and foot, and how even they utilize black folks beta blockers when they should have been using an ARB or an ARB or maybe an ACE inhibitor. There were other options for us. And because we weren't able to articulate that to the healthcare provider, we missed out on some things. And I mean, I could continue to touch everyone's area and say that we want to help alpha men become more proactive about their health than reactive. And I think that will induce the wellness component that we're looking for, Brother Marcy. Just me.
Fantastic. Thank you. Let's move over to Brother Deputy Surgeon General Womack for the last question amongst the panel.
Thank you, Brother Sterling. Hope my audio is coming clear. Brother GP Lonzo, thank you very much for your time and your support for this initiative. I remember we talked on the Eastern region in Atlantic City, so thank you. Thank Brother Sterling for his leadership, but most importantly, I want to thank my fellow Deputy Surgeon General and also these team members, because all these men's schedules are very busy, but no one's ever said they're too busy to do the work for Alpha.
Amen.
So thank everyone for that. So I want to ask a two-part question, and one of which is the other side of the coin. I know we focus some on talking about research and focus on clinical trials and other areas, but I want to look at some of the programs we have, such as Voteless People, as a Hopeless People, and seeing if it's a possibility to revise or expand these programs to include education to our Black community about healthcare-based policies that they need to get involved with that may be harmful to our community, but also beneficial. Some of those examples are the Mamas Act on maternal health, Non-Medical Switching Act, Prostate Cancer Prevention Act as well. It's very important because those things that are now that affect us today when we walk out the house, and make sure these policies, one, either see the light of day, or some that are harmful do not see the light of day. So it's a possibility to revise maybe some of these programs that we have to make it inclusive, to include that part of policy. And that's just my first question.
Well, I'm happy to report that VPHP, while it is evolving, it will include more of a voter education, voter empowerment. We are in the process of developing a legislative agenda, which I think this really falls under more, in my opinion, that we can take to on Capitol Hill in the U.S., that we can take to the state legislatures as well. I think it's going to be important. I want to see us become advocates for newborn screening. We are impacted directly when our children are not newborn screened for disease, period. And so it's important. And while I'm not a pediatrician, my area is definitely professionally impacted by that. And if things can be caught early, it can make a difference. But to your point, the policy piece has to be a part of it. We must be advocates for our community. That aligns with our mission. So to ensure that that's going to have a part, or be a part of the pie that's our legislative agenda, you absolutely bet it will. And we can make sure that we articulate those things so that when we're going in and advocate, and we already have some brothers like Brother Danny Davis out of Chicago. Congressman Davis is our brother. He introduced the sickle cell disease bill. And my daughter actually was on the Hill representing a research initiative out of Lurie Children's Hospital in Chicago as a part of their board, talking about this there. If we have to be positioning ourselves, and also finding a way, if we can, to participate in with the Divine Nine as an aggregate, maybe all the fraternities when it comes to male health. But I think your point is very well taken, Dr. Womack, about having a legislative arm or bullet pulpit to make sure that we're advocating for the right policies. Absolutely so.
No, thank you very much. And this one should be very quick, Brother Sterling. And this is just a continuation of that discussion. I know our group submitted a policy briefing to your office that lists some areas where we should take positions. And the question is, should Alpha Phi Alpha look to start creating a State of the Union annual report to either present to places like the Congressional Black Caucus and to others, so that it's actionable items, and to say, hey, you're talking about it, but we're watching what's going on, and these are the items that are going on in our community, so that way it stays on the radar and it doesn't disappear?
I am very open to the concept. I know that the Urban League, for example, presents a document very similar, but I don't know if they would have the scope that we have. I won't rule out and say that we can't have one of our own, but I want to make sure that we think and do it smart. If we can be a part of writing a consensus statement, more than one voice makes things amplified. But to say that we should drive that or be a driving contributor, absolutely so. And if we have to stand out on some matters alone, absolutely we can. I have no reservation at all. We want to make sure that we continue to lead and do the things that we do. So if it comes to any of the areas that we touch or we feel needs to be advocated, and we're even trying to work on a policy perspective, we can definitely leverage that component as a fraternity. I'm all open for it.
Thank you.
Thank you, Dr. Woodard.
We've come upon the hour, and we're going to do one last question and then have some closing comments from Brother General President and myself. But as a matter of fact, let's just toss it back over to Brother Lonzer by asking you, what should we specifically anticipate? We already know this, but we want to communicate to the audience what we should anticipate from the Surgeon General Initiative in this upcoming year.
Well, in the upcoming year, we will continue to focus on mental health. I can guarantee you that. And as we are getting ready to go into the General Convention, the convening of the supreme governing body of the fraternity, we'll look for somewhat of an update from the Surgeon General Initiative so that brothers can understand what we've been able to accomplish, what our areas of focus will continue to be, and other new areas that are coming on into the paradigm. That we, even in some respects, although the sexy flash of it has gone away, continue to focus on the metabolic syndrome, which continues to plague our community in particular, in coupling that with mental health issues, family health issues, as well as managing the pandemic preparedness mindset. Uh, and I think one of those that are underemphasized is around dental health. We want to make sure that folks are getting and having a well-rounded, healthy experience as an alpha man. So I think we will also begin to project some of the components as we land this administration in 2024, where there's some overarching goals, but we'll be thinking about the turnover and the turnaround of that message and how we're repackaging it to say if we are aligning and realigning, aligning along legislative lines so that we integrate Alpha Phi Alpha's Surgeon General Initiative into the fabric of who we are. And I think that will be a great takeaway.
Yes, and I think we are still plenty sexy. Maybe we just have to get the right camera angle.
Now, the right camera angle and a little less, I'll color it in. I won't spray, but I'll color it in, making sure it's not gray.
I was drawing an analogy. I think that we can always improve upon our communication to the brothers and enhancing what they know about what we do, because the information is there.
Oh, absolutely.
We just want our brothers to partake and to know that we are here for them. I want to follow up on the great work of Brother Womack mentioned, because that's how I wanted to close this evening. This is the time of the year in which we want to give thanks both to you, Brother Lonzo, for your leadership in this regard and allowing us the privilege of serving and representing your administration with this initiative, and certainly to the deputies. It is simply, it's very interesting to see just how much talent exists amongst the brothers in the fraternity, and being able to, as you have described, to point it in the right direction, to not create so much of a bureaucracy that we're stifled and paralyzed by inactivity and collapsing under the weight of all the things that we're trying to do, and all the while to provide a meaningful experience to the brothers who receive our information. So again, thank you for the privilege to serve, and to the brothers who have been making these absolutely fantastic comments. We hear you. And as a matter of fact, I'm here to tell you that in January, we want to have a session that is all about you, where we simply engage in an open forum session to where we can be responsive to some of the questions and concerns that you have. Because this evening, of course, we don't have the time to address the individual questions as we typically would do given a topic. We always want to take advantage of the time that Brother General President offers us. So with that being said, as I always say on behalf of our General President and the Board of Directors and the Brotherhood of Alpha Phi Alpha Fraternity, I want to wish everyone a happy holidays, and we look forward to seeing you in the new year. And thank you for your participation and support. Good night.
Good night, brothers.
Good night.